Our next speaker is Professor Gary Geelhoed, who probably needs no introduction to any of you. Gary is Executive Director, is that correct, of WAHTN. Prior to that, he had a long history with WA Health, firstly for 20-something years as a clinician at PMH, and more recently as the Chief Medical Officer of Western Australia. So thank you, Gary. If you can come up and tell us about WAHTN's experience during this crazy time.
Thanks, Sue. So as I mentioned the other day, the first day, so basically WAHTN, I gave you a short history of that, and there's 10 of these groups around Australia, and that's the WAHTN, all those partners. So clearly when this pandemic started, everyone was looking to see what they could do, and clearly we looked at to see what WAHTN could bring to this. And the raison d'etre for all these, for WAHTN and all those other groups around Australia was really, as I said, bringing people together, academia, research, clinicians, how could we translate things, how can we do research more efficiently, and so on. So the challenges early on, obviously, as the panel said earlier, is that we really expected the worst, or were trying to anticipate the worst. And if you remember, and that wasn't wasn't being unrealistic when you see what happened in Italy early on and what's happening in India at this stage. But we had a real challenge, and the world really did change. For me, it was a sort of driving down a deserted Hay Street and can see flashing lights outside the Subi pub, and the sign said, toilet rolls, $1 a roll. You could get going through the bottle shop drive-in, and I thought the world, as we know, has changed. So we were trying to get people together, but then we got the sort of, if you like, the imprimatur of the Health Minister, Roger Cook, who asked us to sort of bring people together, and I think people, would take notice of that. And we had some track record already bringing people together around the NIF funding, the imaging funding for research, the NCRIS funds, bringing people together around biobanking, trying to standardise that across the state, and also lobbying, as Darren was mentioning, the Guardianship Act of 1990, to get changes to that as well. So we had a bit of a track record. So where do we start? Well, as you'll be hearing in great detail, the next speaker, Toby Richards, he was very fast out of the blocks, and he came up with the COVID research response, and he'll talk in a lot more detail, but in very broad terms, what we were looking at is understanding that if these huge numbers were coming through, the people who were at the coalface and working wouldn't have time to help with research, which they often do, in more normal times, that we needed to consent those people, standardise the processes, to take samples, to have the ability to, capture all the data and have all that standardised. So that was a very good model to start with. So we worked closely with Toby, and our role, I thought, was to roll it out much more, broadly, and put it into a broader concept. We created a web page on our website where sort of trying to give information to people and explain what was going on. You'll see there in the green, it says there was a guiding document. And again, that was largely based originally on Toby's work, but then as our, the width and breadth of what we were doing broadened, we kept, updating that, and that was something people could keep referring to. So we decided clearly we'd have a meeting. So you can see there the first meeting was in March. So that was, as we did back then and still do now to some extent, all done from my bedroom. Put out the call, wondering how people would respond. I think we got close to 50 people on that first meeting, and subsequently you can see there the meetings and the links there to all the minutes from all those meetings. So we had tremendous response right across the sector. And down below there, when it was really getting hairy and we were really trying to move very fast, we even had a smaller group meeting each week as well in April. And again, we had all key related documents, West Australian Government announcements, news and media, and then links to all the appropriate places, the Australian Government, West Australian Government Health, etc. One of our concerns was existing trials that we were aware of. There were things in place that could be sort of ramped up, as it were. two that came to mind, the remap cap and the ascot, and I think we're hearing about certainly remap cap later today. And that was a very trial that was everywhere. It was ready to go when you got a whole lot of respiratory illnesses, and this was tailor-made for it. And so part of our brief then was to try and make sure that access to that was was made as freely as possible and try to make sure it would be rolled out to other hospitals and so on, not just in the tertiary hospitals. And also the Guardianship Act came into play as well, because if people were so sick they couldn't give consent, they wouldn't be able to go in those trials. And for people who know, remap cap was basically about treating people in ICUs essentially, and trying different ways of helping them. And the ascot trial was more people hospitalised, but not quite at that stage. And so, for instance, now the reality is, as we know, and it's been a blessing, that we didn't get enough cases for a lot of these trials, but the remap cap, for instance, early on showed that steroids helped, in other centres. And so that was an early concern. As Darren mentioned, we've given $3 million for trials and infrastructure. We're also promised another $1 million from another government agency, will remain nameless, who actually rang me and said, here's the money, but it never arrived. So we thought we had $4 million to play with. As it was, we had that $3 million. Again, we got Peter Clinken, it was mentioned, to host that panel. You heard Peter speaking earlier about everything he did with industry and so on, and then the money that he got from outside of health. And again, we were able to work closely with him and make sure we won't, it was all complementary and we weren't sort of, doubling up. The $1 million for infrastructure, as I say, we were able to build on the consensus that we had, or the steering committee that was working in infrastructure, and we could see that was a great investment in the future, as well as in managing COVID-19, assuming there was going to be all these huge numbers of patients. When that money was given out, though, already there was a hint that maybe we were going to do well in WA, and so there was a caveat put on it to say that if it couldn't be, the trials couldn't go ahead because of small numbers or no numbers, that the money could be repurposed, and that has happened to some extent. So out of this, we had an integrated model where basically. We were going to try and put resources in across all the major teaching hospitals where people can be consented, they could have their samples taken, etc. And what was great was the way, a lot of people were still doing things outside of this, obviously. They were talking to government and philanthropists and all the rest of it, but we felt we had a sort of a central area where people could come and discuss the different things that they were doing and make it more efficient. So we did get funding from the health department. We did get through, Peter Clinken, that managed to get all that funding to the universities and then for research. Philanthropy was interesting, and I haven't had much to do with that world, but had a lot of conversations with lots of people and the way they would want to work, and a lot of it was just giving them a sort of an overall view as the so-called honest broker about where they could help. One of the things we found, of course, though, some of the proposals were going to take millions of dollars, and if you only had $2 million to put all in the one basket, that wasn't going to happen. But we were able to talk to people and have them talk to philanthropists, and some of those were, they were funded. And another thing about that was, for instance, one group came to us and we spoke to them. They said, look, we really think we'll want to give the money where it's going to be doing something, and more or less saying, all the expertise is over east, which was very disappointing because it was something like close to $500,000. But in fact, I was able to put them on to some of our leading stars here who convinced them that they were doing very good work, and in fact the money stayed here in WA, which was great. So out of the oh, and I mentioned also the foundations, so that's Spinnaker and Charlie's and Royal Perth were keen to help as well and be part of this integrated sort of model. And so where they couldn't sort of fund outside their area health service or perhaps even a hospital, they were happy then to say that they would fund the support people to deal with all these large numbers of COVID-19 patients as we thought there would be. So again, it was just this feeling of a sort of a joined up model. And so out of the collaboration, and you'll hear different speakers, today, there was a lot of people, changing and adapting. We'll hear from, Chris Reed, who had ongoing work in cardiovascular studies, who was able to pivot to look more at what was happening with COVID. And of course, as the numbers obviously weren't being realised, a lot of it was then about the secondary consequences of the shutdown, the lockdown and so on, and how that affected people. Again, we'll hear from Swan Conference, who's got this dozens and dozens of mental health people meeting regularly to see what they could do across the board. Dom Mellon and immunologists and other professionals, again, looking at that and starting to look to how do we get out of, what do we need to get out of this situation where we're in this artificial bubble now, and, what tests we're going to need to make that as safe as possible and as flexible as possible. And Michael O'Sullivan's going to be talking to that. The ANPC, I spoke, Australian National Phenome Centre, I spoke briefly 2 days ago about that, and that was a great success for WA, collaborating, everyone coming together and creating that centre just a couple of years ago. And of course, it really came online, was up and running right at the time when we would need, they could really contribute to the research. So we're really looking forward to hearing Jeremy Nicholson speaking a keynote address later today about all the work they're doing. And unlike a lot of our researchers here who had limited access to samples because of Jeremy's links with Imperial College and Oxford and so on, they did a lot of work with literally thousands and thousands of samples from patients and health professionals from the UK and elsewhere. Look, all in all, I think it was, it was a great example of being able to bring everyone together, and I think, getting more efficient than we otherwise would have been. A lot of collaborations came out of it. I mentioned ARA there, that's the Australian Health Research Alliance, those 10 groups. And I mentioned that because, at our monthly meetings, we would find that, we seem to be the best organised in terms of getting that together and our links to government and so on here. And I think we, to some extent, with the envy of those other groups. So look, the obvious things, the cutting of red tape, as we saw before, when there's real urgency, you can do these things. And of course, we go back to what's, usual, but really we should be taking that example going forward. It's amazing what happens when you have common purpose and funding. It's like moss to the flame, but we really did get everyone together, and there was a great sense of collaboration. New partnerships were formed, some of those still going on today. And I think right at the start, though, knowing that the health department and the minister was saying, look, can you do what you're meant to do, bring everyone together, was a great thing to have behind us as well. So, thank you.
Don't run away, don't run away. Do we have a question for Gary? Okay, so I do have a question.
Oh.
What's been the biggest challenge in establishing WAHTN and basically herding all the cats from their various realms?
Oh, look, it just takes time, I think, and trying to get some runs on the board. And I think that's where perhaps the work we did around COVID-19 maybe advanced that cause maybe a year or so than otherwise, would have. Certainly, again, I keep referring to ARA, but some of the groups who were established a couple of years before us, they've found that they've just gone from strength to strength and so on. So it's a work in progress.
So are you having sort of more buy-in from the general research and clinical community as a result of your exposure during COVID?
Yeah, look, I think so, and people are still funding us, and we've had new groups come to join us. So I think that's been a vote of confidence. Yeah.
Brilliant.
Thanks.
Thanks very much. So I'd like to.